I will put myself on talk.
There, that's it.
Good morning, Chairman Ashew, Ranking Member Guthrie, and members of the committee. I really appreciate being able to be here to share a little bit of my story, but also the things I think this committee is doing excellently in ways that you can continue to support Alzheimer's families and their caregivers. So as was mentioned previously, I'm a Capitol Hill veteran of about 25 years. I'm a former Assistant Secretary of Civil Rights at the Department of Education. Have had a lot of honors and privileges in my lifetime. This, I would say, is the best job I've ever had. I was working in the U.S. Senate for all of that time. Despite that fact, and being knowledgeable, as I thought I was, about healthcare and the needs of very vulnerable communities, and the fact that my brother is a physician at Vanderbilt University, and that my sister is a trained professional educator in Baltimore, Maryland, we were all completely blindsided when 8 years ago, my father received a diagnosis of Alzheimer's. Now, we shouldn't have been surprised, I guess, because 7 years before, he started displaying certain symptoms. It took us that long to get a doctor to actually tell us what was going on. And that was lost time that we can't ever get back. And it was unfortunate and it was unnecessary. So we received the diagnosis, we were given a prescription, we were given the name of a doctor to go to see who was a neurologist, and we were basically sent along our merry way in a daze. This is something that you're just not prepared to hear. No matter how extensive you think your knowledge is, this is your father. This is the man who did everything in your household, all the electrical, the painting. Even if he didn't know how to do it, it got done by him. So we left there, and we were like, where do you start? You're given medications. What do you expect? How do you manage this condition? What does it mean in terms of long and short term? What are the financial realities of this? My parents were working class people. They didn't have long-term care assurance. What are we going to do as a family? We know we're going to come together and make this work, but what do we really do? You're not given any support. You're not connected to any resources that might be able to help you along this journey. Just a script and a good luck. You don't even know what questions to ask because you don't know what you don't know. You don't know what resources exist or whether they'd even be helpful to you. You don't seek caregiver support because, like a parent doesn't consider him or herself to be a child care provider, you don't consider yourself to be a caregiver. You're the mother, daughter, sister, spouse of a loved one, of a father, of a mother. So you're just lost in that moment. So I'm here today, and I know I'm just one person, but I want to let you know that I represent the 6.2 million Americans living with Alzheimer's. The scary thing is that number is expected to double by 2060. 13% of Americans in the US are African American. 20% of persons living with Alzheimer's are African American. Yet unfortunately, only 3% of African Americans are included in clinical trials to find better treatments for everyone. So I would say we've got a real problem on our hands that we have to address. So I'm here today to urge consideration of the bills on the agenda as a lifeline for caregivers who unfortunately are forced often to deny their own health and well-being while caring for others. Too often this results in physical and emotional deprivation, sometimes resulting in the caregiver becoming sicker and dying sooner than the loved one that they're taking care of. The Alzheimer's Caregiver Support Act authorizes the Secretary of HHS to award grants to public or private nonprofits to expand and offer training and support services for families. Now, at UsAgainstAlzheimer's, we've done surveys of caregivers and their families to understand exactly what mattered most to them. We found that the majority of caregivers reported that their own healthcare provider knows that they are caregivers, but 74% report that the doctor hasn't mentioned anything about resources that might be available to that person. For those who actually did receive training, about 50% said they did not receive it at the appropriate time, and fewer than half felt it addressed the situations that they actually faced. So I'd like to thank Representatives Waters and Smith for their leadership in introducing this important piece of legislation and working to improve it. I know that I'm at time, but I just have a little bit more to say, just for a few seconds, if that would be okay. I first want to associate myself with all of the comments that were made by Dr. Wilborn. Having a qualified, well-trained, diverse workforce will be essential to all that we do in this space as the United States continues to brown and age. We will be the new majority, and we already are in 7 different states in this country. Finally, I just like to thank and mention a couple of other bills that are before the committee and a policy that I hope all of you will support. The Change Act sits before the committee. That will help ensure that we have early and accurate diagnosis for people like my dad, where we didn't have to waste 7 years. The ARPA-H legislation that the chairman has graciously introduced will help us understand and make sure that we have innovation and research that we can hopefully prevent and treat this disease with critical innovations that are necessary. And then paid leave, which currently is pending before Congress, is absolutely a lifeline for America's caregivers. I'm grateful that I live in a position, I have a position where I am able to access paid leave, but only 77% of American workers do not have that. Mm-hmm. So I really feel like that's an important lifeline and a strategy that we need that will allow people to be able to take the time that they need to care for themselves and to make sure that their loved ones with Alzheimer's get the support and the care that they need. Thank you.
Thank you, Ms. Monroe.